Okay, welcome everyone. Again, my name is Mohammed Al Kudaimat. It's really a pleasure to meet all of you, and especially for those who attending our meeting for the first time. I hope you can hear my voice clearly. So just wave or maybe send in the chat if you can't hear me. I'm assuming that there will be like more people joining, but I guess we can get started. I'm going to give very brief update about the group activity, and then we can get started. Also, feel free if you want to just make your video on, or if you want to just ask any question, just let me know, and for sure, the ground is open for any question. So this is especially for those who just join us for the first time. This group is part of the SIOP Global Health Networks, and we're meeting every month. The focus of this group is on traditional and complementary medicine use in children with cancer. This is a kind of common use worldwide. So children with cancer from different countries, from different cultural background, they are using complementary approaches, a kind of common. And the main focus of this group is to study this and help healthcare providers to initiate open, non-judgmental discussion about this use, because children with cancer at their brain, they're using those products and practices. Most of the time, they don't voluntarily disclose, or even sometimes there is a kind of negative reaction from healthcare providers. So our group advocate to have this kind of open discussion, a non-judgmental discussion between patients, family, and healthcare providers. Now, in terms of the group activities, so the last month we were working on different projects, as I mentioned. So there's one project in Germany. Ahmed Faraj and myself are co-leading this project, and we are studying the use of traditional and complementary medicine among refugees and immigrants in Germany. We submitted the proposal for REP, and hopefully we will get approval soon to start data collection. So hopefully, Ahmed, next SIOP, we will share our findings with everyone. Also, we have like a systematic review. This was the umbrella kind of a project where many members participated. So big thanks to Hannah Badran, Ahmed Faraj, and Ziad Ustaz for working on the screening and data extraction. Right now we have the data extracted, and we plan toward having this published in June or July, maybe. Hopefully, maximum by July it should be submitted for publication. And based on this systematic review, we have like a small kind of narrative reviews. One of this narrative review that we submitted an abstract to SIOP this year with a group of Turkish amazing researchers, Jandan and Murat. And hopefully this will be accepted, and we present the findings about traditional and complementary medicine use in Turkey. So without further ado, I'm gonna just ask Ahmed to share screen. And from now and then, if you have any question, if you want to share anything with everyone, and also I would like to hear from the new who just joined us for the first time in this meeting. Sayed, I see Sayed, and Kashma, I'm sorry if I'm not pronouncing your name right, and Alvaro. If you like just to introduce yourself, and then we can get started with Ahmed. Saeed, can you hear me? Oh, he's not here anymore. Anyway, Okay. Do you have any question? And again, this session is recorded. So I received the DM from different members that they will join us later, or they might not be able to join, so we can share with them the recording. So Alvaro, so go ahead, please.
Good morning, everyone. My name is Alvaro. I'm from Bolivia. This is my first time in this session, and thanks a lot. I will be here to hear this session, and thanks a lot.
Thank you so much for joining. And please, if you have any questions, so basically this session is Journal Club, where one of the group member present one article or maybe few articles about T&CM use in a country or a region or any interesting part of traditional complementary medicine use. Ahmed Faraj is a pediatric oncologist, and he has BMT specialty. He's from Egypt originally, working right now in Germany, and he's gonna talk today about traditional complementary medicine use in children with cancer in Egypt. So Ahmed, if no one has anything to share, then Ahmed, the floor is yours.
Hello everyone, nice to meet you again. I just want to share my screen. Can you tell me if it's shared or not yet? Okay, super. So I will speak today about the traditional and complementary medical therapies in pediatric oncology in my locality. This is in South Egypt Cancer Institute in Egypt. At first, I want to give just a case presentation, which I can remember it from the first year of my start working in South Egypt Cancer Institute. We have a new patient presented to us. She was 5 years old, presented with a huge abdominal mass and respiratory distress. She was admitted at our department for the diagnosis and staging. The diagnosis was Burkitt's lymphoma. The patient received her initial therapy, the cytoreductive therapy after, and of course the supportive therapy. After that, she has an improved general condition, and she asked us to discharge her just for a few days before starting the next block. Because the general condition was better improved, we have discharged her, but the problem is she didn't appear again for the next block as she had said. And we couldn't reach her parents through the telephone. A few days later, we have a creation room in our department for the children to play in it and drawing, and they have television inside this creation room. I can remember that was my night shift, and I was in the doctor room. Then the patients, the children inside this creation room have called me very loudly, "Dr. Farag, come rapidly." I go to them. I thought that there is one very ill or something like that, but I was surprised that they have seen a program in the television, and that was this patient who we have missed her. She was in a program from desert. It's very far away from our city. It's about 12 hours far away from our city. And this program was about the therapy with camel's urine. They give the camel urine for the patients to drink it. They think that helps in the therapy. This patient presented to us again later on, of course, very delayed for her chemotherapy block. In general, she was not compliant with her therapy. Unfortunately, she died later on from a progressive tumor. So traditional complementary medicine use is one on the rise globally. It's a way of life in many countries, especially in Africa and in Asia. Families, of course, do everything that they can do to cure the child. Unfortunately, there are no studies on the traditional and complementary medicine use in pediatric oncology patients in Egypt. I have just found in the adult oncology, but not in the pediatric oncology. So just for the definition about the difference between complementary and alternative therapy, complementary when it's used in conjunction with the mainstream medical therapy, while the alternative therapy, it's used in place of the mainstream medical therapy. What's the problem of using traditional and complementary therapy? Many questions are arising. If this therapy is really effective or not, does it have any adverse reaction with our chemotherapy or the radiotherapy, for example? Of course, it's well known that the herbal complementary and alternative therapy, it's one of the most common alternative and complementary therapy. The question is if it's contaminated, for example, from insecticides, if it can cause any allergy for the patients. Of course, these patients can lose a lot of time and money while the tumor progresses. And then they present to us in a very bad general condition and end-stage tumor. So the objective of our study was to report our experience in South Egypt Cancer Institute on the prevalence and types of traditional and complementary medical therapies in pediatric oncology patients in our locality. This map, just to show this is Egypt. Here is Asyut, where is the South Egypt Cancer Institute. It's important to say that in whole of Egypt, there are just 2 cancer institutes affiliated to a university. One of them is Asyut University, and the other one is, of course, Cairo University. Of course, in Egypt, I think it's like all other low middle income countries. Most of the services are going to the capitals, and they ignore, unfortunately, other cities. Although Asyut is the 4th largest city in Egypt. And because it's affiliated to the university and one of the largest cancer institutes, it's a referral center for the pediatric oncology patients from the whole of the south of Egypt until Luxor and Aswan, also to the Red Sea governments, Hurghada, for example, and also for the New Valley area. The pediatric oncology department in South Egypt Cancer Institute receive from 150 to 200 new patients per year. Our ward has 40 beds. We have also intensive care units for pediatric oncology patients, 8 beds, and 2 beds for the palliative care unit. The outpatients and daycare units serve about 60 patients per week. I like this slide because it reports some facts from our department in South Egypt Cancer Institute. Between 2006 and 2010, we have received 712 new patients with cancer referred to our department. Unfortunately, 3% of these, 21 patients, presented in a very bad general condition and died within few hours after presentation, although the median duration of symptoms was about 3 weeks at home. And then they presented to us in a very bad general condition and died directly. In addition, 3.5%, 25 patients escaped during the period of initial admission to the department, during the period of diagnosis, either before reaching a final diagnosis or after reaching a diagnosis, but before start of therapy. Just being by us in the department, it's in a cancer institute. A lot of parents think that cancer is not treatable, and they prefer to go home and wait for death instead of losing time and money in the therapy. Although, of course, the service by us in South Egypt Cancer Institute is free, the parents have not to pay any money. From these 712 patients, 15%, 75 patients were non-compliant with therapy, either delayed for at least 1 week for the scheduled time of the chemotherapy cycle, or escaped totally further treatment. So regarding our study here of the traditional and complementary medicine, we have included all patients of all genders up to 18 years old at the time of first admission under any phase of therapy through a cross-sectional study with a questionnaire. I have done this interview with the parents under consent, of course, focusing on their education level, the monthly income and residence if they are living in rural areas or in the city, the type of traditional and complementary medicine if used and reason of its use, and their opinion about this traditional and complementary medicine, if it was helpful or harmful. And this is the shape of the questionnaire which I have filled with the patients, including the residence, the parent status, I mean, if they are married or divorced, or the mother is a single mom, the both parents' education level, and if they are working or not. I have asked some patients, all the patients, about the parents, about the diagnosis, if they know what the child has or not. And also I took from our records the final diagnosis and stage of disease. I asked about the initial symptoms and time of starting the initial symptoms, and number of nodes of therapy which the patient go to them before reaching our department. The lag time between first symptoms and until first presentation to us. If there was any use of the traditional complementary medicine, then we asked more about its type, including if it's herbal, nutritional, from animal use, non-prescribed medications, vitamins, minerals, lifestyle change, massage, acupuncture, pressure, prayer or religious therapy, something called hijab is famous in our locality, or magic use. The reason of its use and their opinion, as I have said, and the cost of this therapy in our local currency, 10 Egyptian pounds, it means about 50 European cents. The duration of using this complementary and alternative medicine, and what's their opinion, if it's better than the chemotherapy, for example, or not, and if they told the doctors about its use or not. Also, I have asked about the monthly income of the parents. So I want just to show some pictures because my city, for example, in Egypt, it's famous. It's one of the poorest cities in Egypt. Most of our patients who are coming to us are very poor, of course, and illiterate. So this study have included 86 patients. The mean age was 7.7 years, male to female ratio 1.7 to 1. About 1/3 of the patients were having acute leukemia. As of all of our patients in our center, the brain tumors are very rare by us. That's because most of these patients with brain tumors are directly going to Cairo, where are better services of neurosurgery and radiotherapy. 94% of our patients were Muslims and 6% were Christian. Most of them were coming from rural areas, about 83%. They need, most of them, or the median time for the travel duration from the patient home to our department was about 2 hours, but also reaching to 8 hours for the patients who were coming from Aswan or from south of Egypt. The median duration between the first initial symptoms and first presentation to South Egypt Cancer Institute was 1 month. The number of nodes of therapy, I mean how many centers have he visited, was about 4, ranging from 1 to 13. The mother education level, 60% of them were illiterate. As was expected, most of our patients are really very poor, receiving less than $50 American, for example, per month. I have asked the patients if they told the treating physician if they are using complementary and alternative medicine or not. Unfortunately, most of them saying not. I mean, 85%, 85 patients from the 86. So the traditional complementary medicine was reported by 52 patients, I mean about 60% of this cohort, 71% have used it as a complementary therapy and 29 as alternative to the medical therapy for some time. The traditional and complementary medicine use has caused a delay in first presentation, range from 1 to 2 weeks in 6 patients. Regarding the therapy status at the date of questionnaire, it's important to say that 61% from the newly diagnosed patients before starting of chemotherapy have already started to use the traditional or complementary medicine. And since that time until the end of therapy, of course, number of patients are increasing. That means that they started the use of traditional and complementary medicine in early phases of diagnosis and treatment, about 73% of the patients. So what about the types of the traditional and complementary medicine? 63%, as was expected, the most common was herbal. Nutritional change in the nutritional habits was about 33%. I was surprised that 29% using magical therapy, about 20% using religious therapy, either for Muslims or for Christians, and 15% asking for massage. And 48% of our cohorts were using multiple therapies. So just some photos of these common therapies. The herbal therapy is very common in our locality in Egypt. I mean, I think in every street you will find shop for selling herbs, and you can go just very easily to that shop and ask the seller that you have common cold, for example, or you have pain, or you have any problem, and he give you directly a mix of herbs to treat you. This is in the middle. This is the thing called hijab. We found it with a lot of our patients. They go to a person and give him money, and then he make a small paper like that, and with very strange words and numbers, and the patient keep it in his pocket, for example, or in his trouser. Yeah. A lot of patients also have reported the use of some type of fruit. It's called qashta in Arabic. They think that it treats cancer. The monthly cost of the traditional and complementary medicine in our cohorts, of course, most of them have paid less than $3 American per month for this therapy because they are already poor and cannot buy the expensive things. 62% of the patients reported that they used the T&CM to treat complications of therapy. 21% to treat pain. It's interesting that 21% and also 10% extra to treat the cancer itself or the undiagnosed disease at the initial presentation. 15% to improve immunity and 10% just for relaxation. So where were the advisors for the use of T&CM? 68% were coming from family and neighbors. 21% from other therapists, for example, his special pediatric clinic. 15% from the neighbor patients inside the wards of our department. They give their experience to the others. 4% also was the T&CM representatives were coming to our department. We have seen them several times, religious people, for example, just to put something for the patient or give him something like magical water. And it was a self-decision from the adult patients by us in 2%. What about the patient's opinion? It was also interesting that about 60%, I mean 38% plus the 27%, have reported that it was at least as effective as the conventional therapy, or even it's more effective in 38%. Just 35% reported that it was not effective at all. Regarding the examined factors which may affect the use of traditional complementary medicine. We have examined the gender, the diagnosis itself, the difference between leukemia and the other solid tumors, place of residence if the parents were living in cities or rural areas, the mother education level, religion, parents' relationship, if they were married or divorced, and the monthly income. In our cohorts, we have found that just the monthly income, if the parents are relatively, I will not say rich, but better than the others, I mean, they receive more than $50 American per month, they were more significantly in use of the T&CM. What was our recommendation for these patients in general? We look at what they are using and think if it's effective and safe or not. If it's both effective and safe, we encourage its use. If it's effective but not safe, and the patient insists to use it, we accept, but we ask to monitor closely for any side effects. If it's not effective but safe and the patient wants it, we can accept it. And if it's not effective and not safe, we advise against it. So what's the important messages from this study? The use of T&CM in pediatric oncology patients in our locality is common, reaching 60%. Many patients use T&CM, but they do not tell their physicians. Sometimes it's harmful. It's important to improve the general medical awareness about childhood cancers and improve communication to avoid waste of time. I mean, through the increase in diagnosis delay and then the patients came to us in a late stage, waste of money and additional toxicity. Thank you.
Wow, thank you so much. That was very comprehensive, Ahmed. I want to just throw this question very quickly before opening the floor for more questions. So remind me, when was this data had been collected? So as you know, based on our previous discussion, based on the recent systematic review, that nothing were published from Egypt, right? But all what you have really presented is really interesting, and we should think about publishing this in any form, in a way that we can give people some let's say information about T&CM use in Egypt. So remind me, when was this collected?
Thank you, Mohammed. It was in 2017. It was collected and I finished working it, I think, in 2018, something like that. Unfortunately, I couldn't publish it just because of administrative things in our university. I cannot publish it until now. I have to do something at first administrative by me, then I can, or I am allowed later on to publish it.
Yeah, you mean publishing that in like papers in an article?
I published it as a poster.
Sorry?
Yeah. I have published it as an oral, as an oral presentation in the SIOP meeting, but I couldn't publish it as manuscripts in journal. I
see. So you can present it like this, but you cannot really publish it because there is a process for that. Yes. Okay. So I have a bunch of questions here, but I want to open the floor for anyone to ask. If you like to ask Ahmed any questions, so please go ahead. I can see hands. I see Julia. Julia, go ahead, please.
Hi, this is great. And I hope you can go through the administrative process to publish it, because I agree with Mohammed that it's important. You know, we read a lot from Turkey, and that's where I've gotten most of my information about the use. That I think we think many times that this is only happening in countries that are low and middle income. But I think a lot goes on in the US, but it's much more secret. People are not going to tell you, but they're using it for sure. I'm certain of it. And I just wondered what you thought about, I know people are often afraid to tell their physician something, but they'll tell the nurse. And I wonder if this is not something pardon me, that we could think about how nurses could play a role in helping the family feel comfortable sharing, because I think you're right. I love your very simple chart of safe and effective and how you approach. I haven't seen that before. I think that it's the bottom line here in many ways from a treatment point of view. But if we could get nurses to be sensitized to talking to families or exploring with families what they are using, because we want to avoid the one that is not safe or effective. Because I think there's a lot of, and I think many nurses don't understand many times what this substance that seems to be inert or not having any effect can actually work against the chemotherapy, or can be, I don't want to say destructive, can be counterproductive, or can actually be counterindicated. And so I'm wondering if this committee, and have you guys ever done a joint presentation with nursing? Mohammed, have you ever done something together?
Yes, we did, and we discussed the role of nurses. I guess what you mentioned is very critical, especially what we know that oncologists usually they have this, especially in Egypt or the region, in Jordan, in Middle East. I know I've been in the situation that there was really very negative kind of reaction, and that's why people maybe avoid disclose because of that. And I can recall one physician said, okay, your child will not get conventional medicine because you are taking other medicine, so you can. So it happens. It's matter of fact. It's there, and that's why I guess if we empower nurses and have that kind of a bridge to get this information in less judgmental kind of approach, that would be a good idea. But yeah, we had one meeting with nursing, but we need to have more, I guess. So
I think you, I heard, now I remember, you did a presentation about what is complementary and alternative medicine for nurses. But I think you might consider starting to figure out a way to get the nurses galvanized to be, because we also know that families tell nurses in the middle of the night, we're leaving tomorrow, when they're going to abandon care, and they don't tell the doctor. Or the mother says, my husband is beating me and I'm being beaten, or he's drunk or whatever. And they're telling the nurses things they're not telling the doctors. And something like this, with maybe social stigma or fear to tell the physician, for fear that they will stop the treatment, is a barrier we could close with nursing. I think it could. I also think that if you put a nurse on your research, I would love to see this research that you did, Ahmed, for other countries, and using as a qualitative researcher. I would really be interested in how they thought those CAM and alternative medicines were effective. I would like to go deeper and understand how did they measure effectiveness? When they told you it was more effective, I'd like to know, what did they see? What did they feel? Why did they say something like that? And I think we could build on the work that you did. I think other groups would be very interested in that.
I agree with all of you have said. I want to answer them also. Regarding that, the parents don't tell us. I think it's also our role to ask the parents if they are using anything else or not. Unfortunately, most of the physicians don't have time and interest to ask about these things, because also they don't have enough information about the T&CM to know if it's safe or not, or if there is interaction between them and the chemotherapy. The other point regarding the nurses, unfortunately, in my city, again, we are far away from the capital, and because of that, we have lower quality in comparison with the capital. Unfortunately, that most of the nurses in my department, for example, they finished the preparatory school. I mean, they were 13 years old, and then they started the secondary school in nursing. I mean, it's combined thing between secondary school and nursing, and they start to work at 18 years old, for example. I mean, they are very young. They don't have a real good experience in nursing. It's just a job to gain money. Now I'm saying that because I compare them with the nurses with whom I'm working actually in Germany, for example. Yeah, because of that, I don't think that the patients will trust them so much to say it's something like that.
So the nurses aren't specialized, and you think they're too young for a family to have confidence that they can share some news like this?
Yes.
So you think we need to, do you have nurse leaders on the unit? Do you have older nurses? Do you have any nurses who are 30?
We have, of course, older nurses, but also they don't have a good experience.
Do they speak enough English to attend a SciUp Africa meeting?
Unfortunately, not in my city. No, but maybe in Cairo, yes, they are speaking English, but not in my city.
And do they? I hate to be an idiot, but they speak Arabic?
Yes, of course, yeah.
And are you guys members of the poem group?
I have met them just once before.
Okay, I just wondered, and Mohammed too, does poem do you do any publications or any guidance? Like, for instance, this ethical and legal consideration chart, or a primer, or something that would be locally a flyer or a resource, or something someone could download that was a one page that says these complementary and alternative medications are dangerous to use or contraindicated for these chemotherapies. Do you have anything like that? Like a quick guide, a fact sheet?
Yeah, currently we don't have it, but we have it as a plan. It's a great idea. Thank you, Julia, for raising this up. Yeah, I guess we should work on that and maybe translate to different languages. So yes, that will be one of the plans for.
I think, Mohammed, it will be a little bit difficult because there is a very wide range and varied between countries and religion and different region in the world. I mean, what we are using in Egypt, for example, or southern Egypt, it's not like north of Egypt, not like in Jordanian, not like in USA. I think it's a good idea, but it must be localized in every region.
That's
Right,
totally right. We can do it. I'm sorry, Julia. Like culture, based on cultural background. Like you mentioned, the camel urine. It's common in the region, even in Jordan, in Saudi Arabia, in Syria. So we look at the common things with the safety measure, whether it's dangerous. If there's any documented interaction, we can look at it. So I guess I agree with your suggestion, Julia. It's one of the plan. Maybe we can make it as a priority, and we can come up with this by this year.
Yes, and I don't want to suggest, Ahmed, that you can make a comprehensive fact sheet, but I think if you kept it simple to things that you really, really think, even, and maybe you do it with poem, maybe you do it with the continents, and maybe you do it with poem, or the groups that say regionally, we can tell you this for our region, and break it down like that. And maybe you just do the top most important things you think at first, and then worry about the other things later. Yeah, I don't think you can do it comprehensively out of the starting gate.
It's of course a good idea. Yeah.
These nurses need something. They're going to need something, right? If we're going to harness them, they can be your army.
Yeah. Just for the record, this by 2x2 table, it has been published for the first time in 2004. It's a guide to CAM treatment recommendation by Kimber and colleagues. So basically, this is there in the, maybe we can add this at the bottom, Ahmed. But just I wanted to highlight that. Okay, Hannah, you're raising your hand. Go ahead, please.
Yes. So thank you, Ahmed, for your presentation. It's really great information, and it should be really published. It's a lot of information and valuable information. So I just want first to correlate with Jordan. As Mohammed remember, when working at King Hussein Cancer Center, we used to see a lot of parents using the non-conventional therapy, alternative therapy. And sometimes I remember one patient was using camel urine and camel milk. And I remember at that time, we discovered that they have a bottle of camel milk, and it was hidden in their cabinet. And one of the rules that they took from the person who gave them, that don't put it in the fridge. So it has to be in the cabinet outside of the fridge, and mix it with the camel urine and use it as a portion. And even when we discussed the the not safety of the camel milk outside of the fridge. Even if you want to use the camel milk, it's your choice, okay, but at least not put it in the fridge for some time and then use it, and not mix it with camel urine. How bad the taste was for the children. But they have this idea that this intervention will help my child improve immunity. And they have a strong belief. And even when you try to discuss that with them, still they don't believe. So I was wondering, when you were discussing with these patients, when you tell them that it's not effective and not safe, how open were they to your advice? Were they really following your advice, or were they showing you that they're following your advice and hidden way they will use it? It's nothing that we can monitor, I think. And at the same time, I was also surprised that even highly educated parents and family members were using this kind of therapy as an alternative to conventional therapy, mainly at the end stage. I had a friend who were a gynecologist, and her mother was suffering from metastatic breast cancer, and her belief that camel urine will improve her mother's condition better than any conventional therapy. And she was a gynecologist. So I don't know what to say, but thank you very much, Ahmed, for highlighting these issues. So yeah, thank you.
Thank you. Regarding your first part, if the parents will accept our opinion or not, I think it's according to according to the physician who is talking with them. If he is, I think so. If he is an older physician and they trust him from the start of the therapy, for example, they will hear to him. But I think if he is a very young physician, new physician, and they don't know him from the daily work, for example, or something like that, they will not trust him.
Yeah, thank you. Because I thought, it's going to be their belief in the alternative medicine is you cannot change it because it's different than the chemo. So sometimes you try to reach to a middle point. So at least don't stop the conventional treatment. If you want to give them something that will not harm, but at least don't stop the conventional therapy. This is like the point that we reach. Yeah.
I mean, in many cases, it's not harmful, so why not?
Yeah, their belief is very surprising, actually. This is what I have noted.
Yeah, let me jump here. Again, we're here in this group, or as healthcare providers, we're not against the use of traditional and complementary medicine, because we know it has really very deep root in the beliefs and values and cultural background. But at the same time, our main concern is about patient safety. And I really like the idea of put that as a priority to start working on something practical like fact sheet. Thank you, Julia, once again for raising this up again. So that would be perfect kind of thing that can help clinicians, nurses, and even oncologists and doctors, fellows to look at it and help patients. One more thing about camel urine and camel milk. Another thing that has really safety issues, that camel milk is never boiled, should not be on fire. They just drink it right away from the source. So basically, and also urine. Although we know that urine is sterile, the urine system is sterile, but still, there's something there. Especially, it's not tested, it's not studied. But anyway, I will see if any other colleague would like to share or to ask. Okay, I have a very quick question if no one would like to ask. Now, there's one issue related to the reason of the use. And it has been recommended in literature that one reason of the use of using T&CM in children with cancer, that the parents or family are not happy with the conventional treatment, which leads me to what you mentioned about the background of the local situation, the context there in Asyut. where I guess oncologist to patient ratio is very low. I mean, one oncologist for many patients, and the same thing for nurse to patient ratio. So would you please remind me about this kind of information? Because this will lead ultimately to the patients, the parents will not be happy with conventional treatment and they go to the traditional complementary medicine. Was that the situation back in Egypt, Ahmed?
Yeah, the ratio between the nurses and patients. For example, in the night shifts, we have the ward with 40 patients and we have 2 nurses for the 40 patients. For the intensive care, it's 8 beds, and also there is another extra 2 nurses for them. In the morning, it's different every day, but about 5 to 6 nurses, because there is a lot of work with radiological studies, for example, or to take the blood samples. Because of that, most of the nurses are in the morning. This means about 5 to 6. Physicians in the department also, there is usually 2 physicians. And in the ambulance, there is another 2. In the daycare, there is another 1. They are working under supervision of one of the staff member, I mean, one of the lecturer or assistant professor or professor. But of course, it's overload for all of them.
Yeah, so apparently they focus more on the conventional medicine. They don't have time for that. Yeah, I have here, Julia mentioned. I'm sorry, Ahmed, go ahead.
I have said that one part here during this, although it was not the main thing of our study, I have asked the parents about the diagnosis of the children. I was surprised that really many parents were not aware what's the type of cancer that the child have. And I can remember that one was at all not aware that it's a cancer.
Yeah, I see. This will lead me to jump to the one of the types which really struck me when you said hijab. It's like I was like confusing way we call it hijab in Jordan. It's look like the same thing, something like magical kind of thing. It's writing something on a piece of paper. Would you please elaborate a little bit? I could not really see the breakdown. How many people using this in your area?
Well, this is related to the magical therapy. From this cohort, it was 29%, which is big. But really, in my daily life there, in my daily work, I have noticed that a lot of patients, when I examine them, when I examine their abdomen or thorax, I was surprised by this small piece of paper with strange things inside, I mean, from between their skin and the clothes directly.
Yeah, it's a common kind of.
I'm not allowed to open it. They told me you are not allowed to open it. Please keep it and these things.
Yeah, this is common, but this is my first time to see that this kind of, let's say, approach or practice is done in children with cancer. But I know it's common in the region. They use it for many things, especially for social kind of things, not for medical kind of things. But yeah, I see this is something new to me. Okay, any other question to Ahmed? Or I'm looking at the chat here, chat box, and Julia sent a bunch of messages. Great. So Julia suggests that we include a few senior physicians from the region to help us with the fact sheet from Middle East. She mentioned some names. Thank you so much, Julia. That's very helpful. Yeah. And also Ethiopia. Okay. In my work in Ethiopia, we also had parents telling us they did not know their child's diagnosis. Yeah, apparently they are not really looking at what doctors or nurses telling them, and they do whatever they believe in based on traditional kind of practices. Okay, any other question? So going back to hijab, I was wondering how much that cost, that piece of paper. It's out of curiosity.
Usually, Muhammad, these people who are making this hijab, I mean, these magical persons, they look at the persons in front of them. I mean, they look at the parents of the patient. when they think he is rich, then they are asking for more money. I mean, it's not single price, but it's according to your status.
And also
It's
looking back
as much money from you as he can.
Okay, I see. So going back to the herbs, I wonder if you look at the types of herbs, like what kind of herbs that is mostly or commonly used. We discussed this before, like in Turkey, there was a list of nettle was part of it. So, but I wonder in Egypt, how was that?
In this study, I didn't differentiate, but what I can remember from the talk of the parents with me, some were using just simple things inside home. I mean, for example, peppermint, for example, if the patient have abdominal pain or something like that. And a lot have said very clearly that they are going to the herbal shops and just ask the seller there that they want a mixture for abdominal pain, for example, or a mixture for mucositis, or a mixture for the hair, for example, when the patients have alopecia from the chemotherapy. And the seller gave them directly. We make a mix of these things and give them.
Okay, how about honey? Did you study that? Because the problem that it's common in the region that they give natural honey without
Yes.
any, especially if the child on chemotherapy and there's kind of risk in there. So have you looked at that?
Yes, from a long time, it was very common by us, but then there was a phase that it's not recommended because of the Clostridium. And since then, I think it's not recommended in our department and most patients don't take it.
Okay, I see maybe Murad would like to participate. Murad, if you like to ask anything, so please go ahead. Murad Sawalha, can you hear me? Apparently he's unmuted, but maybe he could not hear me. Anyway, okay. I have another question here, and this is the thing that we would like also as part of this group to standardize how to define traditional and complementary medicine. And it's really an issue here that when we look at different studies from different countries, from different regions, the prevalence rate change basically based on the variety of kind of how researcher or clinicians define traditional and complementary medicine. For your study, I wonder if you had really specific definition or if you adapt the kind of definition from literature of traditional and complementary medicine. What kind of definition that you had in mind when you did your study?
We have put this, the common things, I mean, the herbal, these words, the herbal, nutritional, animal, and non-prescribed medications, and ask the parents if they are using anything of them. If they are using, we consider it as a T&CM.
Okay, great. So another thing that when I came here to Canada, I found that a good number of children with cancer, they're using vitamin C as IV. And there was a story of a child with central line where traditional complementary medicine provider used that central line to provide IV vitamin C, and that central line contaminated, and the patient had some kind of infection which delayed chemotherapy administration. But I see you put here vitamins. So how about vitamins in Egypt? How they use it and whether they use? I know that you mentioned that the cohort is kind of poor. They are not really spending money on those things. But in terms of vitamins, how they or minerals, how they consume this? Is it part of their diet or they buy those kind of supplements?
From in the general population, especially in these poor patients in our locality, it's not a routine thing, but it was available in our hospital as syrup, and most of the patients were asking for it, just because they were having anemia, and we have told them that it's clear after the transfusion they will be improved, but they were asking for that, and most of them received it already from us. Not vitamin C, but it's a mixture, multivitamins.
Okay, thank you so much. So
oral, of course, not intravenous.
Thank you. We have just a few minutes. I have here Krishma. Would you please, Krishma, introduce yourself to the team? Sorry, I plan to have this. I hope you did not leave. Oh, apparently he left. Anyway, okay. So any other question before we conclude our meeting? So Ahmed,
I want to say that it's great that you're doing it. I really appreciate that you're documenting the use in areas that nobody's heard from before. I think that this is something that is really in the remit of SIOP, and I want to really support you guys getting a bigger audience for this. I think you're going to have a real difference to make in the lives of these children and families. I really do.
Thank you so much. I appreciate it.
Yeah, I echo what Julia said, and it was really interesting. We had discussion before, but I did not really have a look on, closely to your data, but that's interesting, and for sure we need to publish that, Ahmed. We should be there and could be published, and hopefully you will finalize that administrative issues. Okay, guys. Thank you so very much for attending this session. Again, the session is recorded. As I mentioned before, we can work on this to make this available to everyone. And I really appreciate your time. Thank you so very much, everyone. See you next time.